The Public Health Institute was founded in California in 1964 to turn great ideas for improving the public's health into action. Our founders saw a need for public health innovation. They wanted to create an organization that could quickly and nimbly roll out new initiatives and research to respond to emerging public health challenges. They believed that this would support and strengthen local, state, and federal health departments. They were right. 50 years later, PHI is one of the largest and most respected public health institutes in the country, home to around 200 grant-funded projects each year. PHI has expanded its reach beyond California and now works to improve public health across the U.S. and around the world. PHI wants to unleash the full creativity and expertise of our organization to respond to the challenges we think are most critical to public health today: the global and domestic obesity epidemics, the ongoing barriers to health and opportunity for women and girls worldwide, healthcare workforce shortages, and the threats posed by climate change. PHI wants to implement new pilot and research projects in these areas and scale up programs we know work as quickly as possible. With your help, we will. Today's health problems are more complex than ever. To develop solutions, we must harness the full breadth of expertise and knowledge available. PHI's work touches virtually every area of public health, which enhances collaboration and magnifies the reach of every dollar donated. PHI is home to experts in community health, chronic disease prevention, health technologies, reproductive health, and more. When PHI tackles a problem, we can harness these intellectual resources quickly and bring a wide array of experts to the table and develop truly comprehensive solutions. Few organizations have this breadth or depth or 50 years' experience implementing successful public health projects. It's this unique combination of intellectual expertise, operational efficiency, and experience that makes us so successful. PHI is effective because at our organization, great minds in public health can thrive. We provide the infrastructure, support, and intellectual freedom that allow our over 100 researchers and directors to quickly implement public health projects that have real and lasting impact. For nearly 50 years, PHI has initiated new projects, incubated new strategies, and enabled research and interventions that otherwise would not have been possible. PHI programs track improvements in health outcomes, reductions in healthcare costs, and changes in health behaviors. We also track policies passed because of our advocacy efforts and published research findings. Here are just a few examples. PHI has published groundbreaking research linking environmental toxins and breast cancer. We've identified health technologies that reduced healthcare costs and delivered a return on investment as high as 6 to 1. We've helped pass landmark child protection legislation in Liberia that protects girls from child marriage and guarantees their right to attend school. In California, our health education campaigns nearly doubled the percentage of low-income Californians eating the recommended levels of fruits and vegetables. PHI is a large and thriving organization, but most of our budget is earmarked by our funders for specific activities or ongoing projects. To truly unleash PHI's full potential, we need a pool of funding dedicated to innovation so we can respond to emerging issues and support cutting-edge ideas amongst our researchers and program directors. Your donation gives us this flexibility. Over the course of nearly 50 years, PHI has evolved with public health, and we've contributed to some of the major advances in the field. We've helped turn the tide against tobacco use. In California, we helped pass groundbreaking legislation to improve health including school nutrition policies and diesel fuel emission regulations, which will help prevent asthma. We've run one of the most comprehensive state cancer registries in the U.S. PHI has trained over 1,000 health professionals around the world, and many are in senior leadership positions now. For decades, PHI has been a visionary leader in the fight against obesity. We've implemented multiple strategies to address an extremely complex problem. These strategies include nationally recognized nutrition education programs, advocacy to reduce junk food marketing to children, and grassroots organizing to help communities make local changes so it's easier for residents to eat healthy and to exercise. Our country spends most of its healthcare dollars treating people after they are sick, instead of investing in keeping people well. In the current fiscal and political environment, this is only getting worse. We must learn to do better. We must learn how to keep people healthy in the first place, which will lower healthcare costs and relieve an already overburdened health system. PHI is committed to doing that work, but more than ever, we need the support of donors like you. With additional resources, we would be able to fund new pilot and demonstration projects or take proven programs to scale, such as a widely successful PHI program that trains low-income youth to become health professionals could be expanded to other cities across California and the rest of the country. PHI's training and support of grassroots health leaders from Guatemala to Malawi has resulted in new policies in those countries that protect women and girls' health and welfare. This leadership and advocacy model could be replicated in other countries. We could fund pilot technology projects that test new ways to use mobile phones to transmit vital health information to hard-to-reach populations. We know what works in public health, but we don't always have the resources to make sure everyone benefits from that knowledge. There are effective PHI programs that could be scaled up. We could train more public health leaders. We could utilize our global network to provide additional technical assistance and consultation to public health agencies, communities, and nonprofits around the world.